Welcome to the Season 4 premiere of the BRG Nurse Executive Podcast. Rejoining us for this episode is Bill Orrell, a registered nurse and managing director of BRG's clinical redesign team. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Bill, welcome back.
Thanks, Nick. It's always good to be here.
Happy New Year.
Yeah, same to you.
BRG had a great year in 2024, not only for us, but also the clients we serve and the patients receiving care from our clients. Can you sum up 2024 from your perspective?
Yeah, I think you're exactly right. 2024 was a very good year, particularly for our HPI practice, healthcare performance improvements. We're seeing a need for continued focus across the country on providing more access to care for patients at a lower cost with greater efficiency. And I think that the fact that this was an election year only added to that focus because it didn't really matter who won the election. There's just so much uncertainty surrounding what the next few years are going to be like, which was prompted a lot of health systems to really focus on getting their house in order this year, whether it's from a supply chain expense reductions perspective or just patient throughput or just getting their house in order in their physician practices. And then, Nick, I know your team, the ED team, also had a great year. And you continue to work with several very prestigious academic medical centers. You published a lot of the great work that you and the team did, presented some really great outcomes at several conferences. You certainly need to talk about that, I think.
Yeah, it's been a great year. It's been a lot of fun, actually, to work with these academic medical centers and help them achieve their goals. And I think the interesting thing for them, and it'd be great to also see this with some of our other clients, is that they want to get out the great work that they did after they accomplished those outcomes. I worked with one academic medical center last year, and we achieved over $4.58 million in benefit in the ED alone. Now, some of that was from left without being seen reduction. Some of it was through turnover reduction because the staff is enjoying where they're working. They want to stay there.
Yeah.
And so not only do we do the great work and the team's proud of the work, but now you've got the leaders and the team members that want to disseminate that. So putting that together and case study with them and then presenting that at a national conference was a lot of fun. And oh, by the way, we had them on for that podcast back in August, talking about left without being seen reduction, Ali Harmon from the University of Iowa. It's also been a great opportunity for us to leverage some of our analytics tools that we use in BRG for things that aren't really related to the work that we're doing, the ability to partner with them on some research and publish some research around what is or is there an impact of boarding on resident education.
Mm.
And we found out that the answer was yes. So that's been fun. That's the fun part, I think, of the job. Change is always difficult and helping our clients navigate change, but publishing these great results and look forward to continued opportunities to partner with other clients to celebrate the great work that they're doing. So,
Well, and you also had a couple opportunities to present with some professional organizations, ENA and others. And I think it's always good to share lessons learned and maybe even some new leading practices we uncovered in doing this work. And having some of our senior clinical leaders that we work with at our clients be as excited about it as we are is always that's a great outcome.
yeah, thank you. As we sum up 2024 and now shift to 2025, what are the continued needs of our clients and what do you see as new or emerging new needs for services that our clients may have?
I think of what we've done in 2024 will continue into 2025. And there's still going to be, despite a new administration, a lot of uncertainty around the regulatory environment, what that's going to mean over the next year to 4 years. I think the focus is still going to be the same. It's how do we provide more and better access to care for patients in and outside of the hospital at a lower cost with greater efficiency and continue to focus on that. And then we're finally starting to see some of the labor costs come down, but there is a renewed focus on making sure that we're staffing as efficiently as possible. We're recruiting the best team members at our health systems as possible. There's a renewed focus on our supply chain and making sure we're using the lowest cost, highest quality supplies for our patients, and also a kind of a focus. We're doing a lot of work around just supply chain operation. How do we maintain the storeroom? How do we maintain par levels so that nurses and physicians have things at their fingertips when they need them and aren't having to search for them, which causes a lot of dissatisfaction in their roles if they're spending time doing that rather than taking care of patients. It's how do we focus on delivering better patient care at a lower cost. That's going to be the same no matter what uncertainty may be surrounding the new administration and the upcoming regulatory environment that we're just not sure of yet.
Hmm. Interesting. Back in, I think it was season 2, we had Peter Chadwick come on, and he was talking about kind of the train is coming, the bus is coming in terms of bonds coming up due and things of that nature. What's the work with Peter been like lately?
Good. I think there a lot of health systems are feeling pressure from the financial markets, from their bondholders. We often are introduced to clients because of that. I think in certain markets and certain health systems, there are a lot of financial pressures, and there are health systems continue to be in financial distress that need a lot of help. I think that we're probably going to see more of that in the coming year to a degree. This past year, we've seen a lot of it just from the financial pressures of these health systems and trying to deal with decreasing revenue in some places and then increased cost and having a history of not managing those things. That's when the financial or the banks have to step in and ask a third party to come in and help. I think we saw a lot of that in 2024. That probably will continue in 2025.
And as we're talking out loud, it's just coming to my mind that we need to have Peter back on
Yeah.
probably
Oh,
later
yeah.
in the year and have him say, all right, this is where we were 2 years ago and what's
Yeah.
coming down the road now.
Yeah.
Now here's the life that we're operating in now and what this means for hospitals and healthcare. Because he's got that really attuned financial lens. Yeah.
He'd be a good one to have because he's really on top of the hospitals and health systems where they are. And then his partner, Haywood, might be a good one too, because he also has a lens on healthcare finance, but also he has more of an ambulatory perspective sometimes, it seems. So he might be another good guest for next year.
We have a new managing director on our team.
Hmm.
What's that about?
Yeah, Jeff Lieback, new managing director within our healthcare performance improvement practice, brings a level of expertise around managed care that we didn't have. Has been doing that work for a very long time. I'm excited about broadening that service offering for us. I can't claim to be an expert or even speak intelligently on what he does, but I know was a gap for us in our service offering with our clients, and now we've closed that in a major way. And I think we're all excited about what Jeff brings to the table. And I know you're going to hopefully have him on the podcast in the coming year too, which that will be great.
Yeah, he'll be on an episode that airs over the summer.
So we've talked at a high level about our performance improvement work, but as we focus more in on the clinical redesign team, how has that work evolved over the past year, and how do you see it continuing to evolve in 2025?
One of the things we've continued to focus on this year is just patient throughput and how do we make better utilization of inpatient beds? How do we make sure patients are progressing as efficiently as possible through the emergency department or through their surgical services, through their interactions with inpatient and ambulatory surgery. And then one of the things we've discovered in this length of stay improvement work, particularly on the inpatient side, is that our traditional approaches to the foundational work is changing. A lot of health systems are adequately staffed in case management. They've done a lot of the basics, the foundational work, and making sure that the folks are working at the top of their license, whether case management, social work, UR, and so on. And so we've started to take a different approach around using the data to help drive the improvements in length of stay, which we call targeted interventions. And I know you recently recorded a couple episodes on that. Do you want to talk about that?
Sure. Yeah. We recorded kind of a mini series, if you will, of 4 different episodes around this topic. And Lowell Hardin from the ED team is going to be joining us on the very next episode. And he's going to talk about just preparing your frontline leaders for success, how to start a performance improvement engagement by giving your charge nurses, by giving your frontline managers the tools that they need to be successful on the journey that they're about to embark on. Change management, crucial conversations, things of that nature, very important management skills training, if you will. And then we're going to segue into 3 additional episodes from 3 different team members on our care transitions team, all talking about different angles of these targeted interventions. One of them is improving length of stay by targeting provider variation, where we're looking at who are the providers that are having significant variation in their practice and how can we bring them back to the mean of their colleagues operating in the same hospital, in the same service line.
That's
Um,
very important and often overlooked.
Yeah, and it's amazing how providers can actually just respond to data of
Mhm.
here's where everyone else is, here's where I am, why am I the outlier, and how do I get to be where they are? And just giving them the data, provided it's accurate data, is amazing how they will change their behavior.
Right.
Another episode is looking at not the outlying providers, but the outlying care units. So, what are the nursing care units or the care units that have excess days, avoidable days, really high length of stay than what they should have based upon the type of patient population that they're caring for, and understanding that different units may require different needs when it comes to case management, whether it's nursing case managers or social work case managers, and talking about the difference between those. Cam, who's one of our social workers, is going to be on talking about that and understanding how do you staff your unit from a case management perspective to make sure that you're meeting the needs of that particular care unit and the length of stay challenges that may be going on.
Yeah, I think that's a really important one too, Nick. We often see within organizations, one unit with the same patient population is performing at a much higher level than others. And what can we learn from what we often call internal best practices? I mean, what is this unit doing differently than others that we're seeing in the data? And then when we spend time doing observations, we start to learn that they're just more efficient because of A, B, and C. And we can translate that into the other units and help bring the whole organization up to a higher level of performance.
And then rounding out the last and final episode of this mini series of 4 episodes, if you will, we'll be talking about targeting lower case mix index DRGs. And instead of focusing on who are the patients that are here for a really long time and we can't get them to a sniff, we can't get them out to an ECF or an LTAC because there's no beds that are available.
Mhm.
Instead, focusing on what is our low hanging fruit? What are the patients that are only going to be here for a day and a half or 2 days? And how do we shave off 6 hours, 8 hours, a half of a day for those patient populations? And that is real by focusing on those low acuity patients. That is really an opportunity how you can accelerate throughput. And this was really interesting conversation for me because we do the same thing in the ED. A
Mhm.
lot of EDs now are going to these for years. They've been doing fast tracks, but now there's this emerging trend also of vertical care and vertical threes. Part of it's related to capacity in the ED and just this is what we're going to do because we can't do anything else. But I think what a lot of organizations have found is that you actually really can accelerate your throughput by focusing on that lower acuity. And again, 3 things or 3 opportunities that we'll talk about on targeted areas to improve length of stay, one on provider variation, one on specific care units, and then the third one on lower case mix index DRGs.
That sounds great. That's a good bunch of good topics.
Yeah,
What other episodes do you have lined up for this year? I know you have several in the can already.
we do. We do. Brian Cody from BRG's Healthcare Transactions and Strategy team is going to join us for 2 episodes. The first will be to discuss his research on the emerging menopausal care market. And then
Mm,
the second episode, he'll be back later in the year to talk about market trends in mental health care.
mm,
In February, we're actually going to release 3 episodes. One of them will be in that mini series that I talked about. The other 2, Audrey McCullough from Pivot Path is going to talk about entrepreneurship in nursing. And then Amy Brown, Chief Nursing Officer at Michigan Health and Hospital Association, she's going to discuss nurse executive roles and associations. So, how you as a CNO can partner with them. And then also, if that's something that you're interested in as a nurse executive, for maybe when it's time for you to leave running a large organization directly impacting patient care to how do you move into more of a supportive role, but still an executive role.
mm.
The incomparable Dr. Lisa Wolf will be back. She's becoming a frequent guest of ours. In March, she's going to talk about moral courage as a nurse leader and some recent research that she's done. And
Yeah, we're gonna
that's
have
an
to put her on
episode
the
you're,
payroll eventually. Sorry
I'm
to interrupt.
sorry.
We're gonna have to put her on the payroll eventually.
That's an episode you're not going to want to miss. And frankly, it'll be a little scary to listen to in terms of some gaps that exist as it relates to ethics and morality in
Mhm.
nursing practice. And then in
Wow.
April, we're going to welcome Dr. Mandy Kirkpatrick from both Creighton University College of Nursing, which is one of my alma maters, and CHI Health. Mandy's going to help us continue our series of episodes on bridging the academic to practice gap. She's going to talk about her joint appointment position with those two organizations I mentioned and the work that she does of pulling those two organizations together to help each other out within each of their wheelhouses, the academic wheelhouse of preparing nurses and providing research, and then also within the practice and how do we bring those two groups together. Later in the year, we're going to welcome back Dr. Anna Valdez to talk about how nurse leaders can promote peer-reviewed publications in their institutions. Jeff Leibach, as you mentioned earlier, is going to talk about what every CNO needs to know about managed care and revenue strategy. We've got some really great content, I think, planned for our listeners. And with that, we're always looking for great guests and great content to bring people to the podcast series. So if you're interested, please reach out.
I was actually going to ask you that question, Nick, because I know we have the listenership continues to go up. And I know that there are nurse leaders at all levels of healthcare systems that tune in. And so if they have ideas for the speakers or guests for the podcast, they just reach out to healthcare at thinkbrg.com. Is that correct?
Yep, it's a great way. Reach out through that email, and then we will review your thoughts and your ideas and be in touch.
Perfect.
Any closing thoughts as we wrap up our episode? This is our 60th episode, by the way.
Wow.
Yeah.
I'm excited for 2025. I think, again, there's a lot of excitement out there, a lot of opportunity for health systems to really focus on patient care this year, not just from a throughput perspective, but how do we provide better access at a lower cost? But it's also how do we, take better care of the communities that we serve. I think that's the biggest thing that many of our health system clients are dealing with or are focused on narrowly, which is good. That's their mission. I'm excited for 2025. I know many of our clients are as well. I know there's, obviously a little uncertainty out there, but that's every year in healthcare. Again, Nick, I just want to thank you for everything you've done for the podcast and continue to do. I mean, you've really turned this into something just really outstanding, and excited to see what the podcast looks like for the rest of 2025.
Bill Orrell, thank you so much for your time today.
Thank you, Nick. Always a pleasure being here.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.